Session title: The Right Information at the Right Time, Supporting the Field with Relevant, Actionable Data. Introduction and opening remarks.
Hello, and welcome to our session titled The Right Data at the Right Time, Supporting the Field with Relevant, Actionable Data. My name is Kate McElroy-Helm, and I am a data specialist with the Capacity Building Center for States. And I'm so pleased that you're joining us for this session. And whether you consider yourself a data expert, a data beginner, or somewhere in between, we think that this session will provide you with some insights and ideas that speak directly to the work that you do. Countless children, youth, and families are living better lives today because of the work of child welfare professionals. And child welfare agencies serve hundreds of thousands of our nation's most vulnerable children every day. And there's really no way to adequately account for the hours of work, the creativity, and the care and compassion that members of the child welfare community provide. And we can always do better to support the field, like by ensuring that our information systems support the work and provide timely, relevant data to support assessment, service delivery, and decision-making. Sometimes a lack of crucial data results in delays in the delivery of needed services, putting children's lives at risk. Other times, we collect data that are never used to derive insights for decision-making, or by the time the data are made available, they're no longer useful. And child welfare leaders often tell us that now that we're collecting all this data, how do we use it? But there's also so much innovation and good, solid, data-driven practice happening across the country. We've learned a lot about how to develop information systems that truly support the work happening in the field, and how to infuse the use of data across the child welfare spectrum and beyond. And as agencies begin to exchange data with tribes, courts, educators, private providers, and others, we move closer to a collective approach to improving the lives of children and families. So today we're going to hear about some of these innovations. We have an outstanding panel of child welfare professionals who will share their experiences, concerns, and hopes for using and sharing data in all aspects of child welfare services. The panel includes an expert in child welfare data exchange, a continuous quality improvement manager, a foster care supervisor, a data analyst, and a young adult consultant. And as you can imagine, they all have different approaches, expectations, and needs related to data, as well as a shared objective of a data-informed approach to improving outcomes and engagement with the families that we serve. But first, we're going to hear from Erin Dalton, the Deputy Director for Data Analysis, Research, and Evaluation with the Department of Human Services in Allegheny County, Pennsylvania. She's going to provide us with some great information about her agency's integrated data system and how they're using data from a variety of sources to support decision-making. She'll talk about the data itself and also the outreach and the relationship building that's needed to make an initiative like this successful. After Erin's presentation, you'll get to hear reactions and discussion from the panel of child welfare professionals. So as you're listening to these presentations, keep a few questions in the back of your mind, like which of the ideas that you heard about you're most excited to bring back to your agency. What would some of the benefits be, and what would the challenges be? And then also, based on the examples that you're hearing, what would you do to improve the quality of your agency's data and promote a data-driven culture? So without further delay, let's hear from Erin Dalton, and thanks again for joining us.
Section title: Integrated Data Systems in Allegheny County, Pennsylvania. Erin stands on stage and addresses the 2017 Child Welfare Virtual Expo audience. Behind her is the Child Welfare Virtual Expo 2017 logo and the Twitter handle #CWVE.
Hi, I'm Erin Dalton from Allegheny County, Pennsylvania. Thanks for having us here to talk in super fast terms about some of our analytics work. Just for reference, Allegheny County is a county within Pennsylvania. Pennsylvania is a state-run, county-administered state. And in January of this year, we had 1,340 kids in care. So that just gives you a sense of our foster care population, and we have about 1.1 million people in the county overall. The county, the Child Welfare Agency exists within a larger umbrella organization called the Department of Human Services. We administer sort of cradle to grave services, including Child Protective Services, homeless and housing services, mental health and drug and alcohol services, prevention, after-school programs, services to the aging population, and so on.
Services also include services for those with a diagnosis of intellectual disability, non-emergency medical transportation, job training and placement for adults on TANF or SNAP, family support, at-risk child development and early education, and centralized financial, human resources, and communications functions.
We have that integrated human services model that we started building back in the late 90s, and to support that model, we have integrated data.
The slide is entitled Integrated Data Systems. It contains a chart with 3 column headings: 1. Internal sources, 2. External sources, and 3. Potential data sources.
So we've got a number of internal sources and external sources. For example, all of the data for the programs we run, like homeless and housing and child protection and publicly funded mental health and drug and alcohol services, all of that is integrated and linked every day. We also have a number of external partnerships, including with the housing authorities, the criminal justice system, which includes the jail and pretrial and probation services and the courts. We have data from the schools. So Pittsburgh Public Schools has been a partner since 2009, and we have agreements with 20 other school districts. We have birth records and medical examiner data to help us understand sort of vital statistics. So we've got a wealth of integrated data to support care.
Internal sources also include aging, community service block grant, early intervention, family support centers, Head Start, and intellectual disabilities. External sources also include public benefits, Medicaid physical health claims, and 911 calls for services. Potential data sources are early childhood, post-secondary education, and labor and industry.
There's lots of ways of using data. Coordination of care, as an example, to support worker decision-making, management decision-making, importantly for community use, open data, and to support research in the broader field. Today I'm going to focus mostly on data for coordinated care and worker decision-making. So a little bit about our data sharing philosophy. I think it's important to note. So since we provide an integrated set of services, we really think about these as one set of services, and therefore these are clients of the entire department of DHS, which means there's not separate child protective services clients and behavioral health clients. As all of you know, many of these clients touch various different service systems, so we really view this as clients of one agency, and therefore this is one agency's data, so DHS data, so you don't need information sharing agreements between these various entities. Another important principle for us is getting data where it needs to be. This data isn't collected so that I can have it to analyze. The data is collected to support families and to support workers with decision making. So a huge priority is getting the data out to the field, out to our provider network, and back to clients themselves. And lastly, data is a public good. When we can, where we can, we have a responsibility to make it available. So we have built applications, technology applications that sit on top of this integrated data that helps to support our workforce to coordinate care. So for the last 15 years, our DHS staff has had this application, and we've now done the work to expose it to the provider network and to clients themselves. And it allows them to access this individual level integrated data.
The screen shows the client search web page and then the client profile page.
The application is called Client View, and the Client View application is a pretty simple one. It has a client search screen, so you can just search using normal kind of parameters for the client, and when you find that client, we display basic demographic information. So the caseworker or the provider or the client themselves would be able to access this application, see basic demographics, see the service plans, see the assessments, and see a service history. They can also use the demographic screen to see other demographic records. So all these different systems collect their own data, and then we integrate that into one sort of winning record, but we store all of the rest of it. So you can access the other address information, for example. I'll tell you why that's important. So if you're a child welfare worker and you see this address for the family, but you don't think they live there, you could access these other addresses and see if you can locate them. We also allow workers through the screen to search the address, so we can see understand household composition and the service history of other household members.
The screen shows the service involvement page.
The service involvement screen tells you a couple of basic things. It tells you the first service, the last activity, what the service is. So it could be criminal justice reentry services, it could be drug and alcohol treatment services, who the provider is. So the provider is also very important so that you can connect with them and coordinate care.
The screen shows the Plans and Assessments page.
And lastly, the plans and assessments are available through the application, so you can download all of the service plans, whether they've been done by an internal worker or provider, as well as assessments. This is important both so that we understand what one another is doing with the client or family, but also because clients and families tell us they don't want to tell their story over and over again, and that's often what we make them do. So a couple of other ways that we're using integrated data, just to quickly walk through this. So take something like school records. So we've had public school information since late 2009, early 2010, and what we do with that, besides kind of understanding more aggregate trends, is to share it back with the child welfare workforce. We push that data into their child welfare case management system so that they don't have to enter it, and that's an important kind of time-saving activity. But we also send them alerts and reports that show them how kids on their caseload are doing. Not to overwhelm them, we only actually share a report, a weekly report, for kids who are struggling in school. So kids who may have missed 3 days in the previous week but have missed 18 days over the course of the year, children who have had a suspension, that's what we're sending back to them so that they can check in on their educational success. We can do the same with other data sources, so vital statistics, the birth records. If we have an open case and a baby is born to that mom, the worker hopefully does already know about that and can check and make sure the family is doing well with the new baby, but they may not. And so we have these data and we can notify the child welfare worker. Similarly with psychotropic drugs, we've done a piece on this and it's also been done nationally. Foster kids are perhaps taking too many psychotropic drugs, sometimes too many at the same time. We just want to be aware of those things. We have the pharmacy file. If we have the pharmacy file, we should use it to send alerts to look at specific cases. So in this case, that alert is not going to the worker, but instead to a clinical manager who can review the case. Just last example, and those last three are things we're just rolling out now. The criminal justice system. If there's been a 911 call to the house the night before, we think the workforce, the child welfare workforce, could benefit from that information, or if there's been, a jail booking for a mom on a case, that's also information we feel like we should share. So now I'm going to move on to predictive analytics or predictive modeling in Allegheny County. For us, this is really just summarizing, another way of summarizing data and packaging it for the workforce so that they can use it to make decisions, and not some big scary thing that people are super excited about and also super concerned about. Just a little bit about our process. We issued an RFP. A lot of times around the country, vendors are approaching child welfare directors and offering services. I think it's important for the county or the agency to say what they want and get proposals back. So we did that, and we got a number of really good proposals from around the country. The folks who won had implementation experience. So they happen to be a team led by a woman out of New Zealand, partnering with a researcher at USC.
The research lead is Rima Waitia Nathan from Auckland University of Technology, partnering with Emily Putnam Hornstein of USC. The names of the other members of the large project team appear on screen as well.
Anyone who's done any of this work in the field knows that the modeling's not the hard part. The hard part is really putting in place something that workers will use and that can be effective on the ground. So this team had that experience. They also shared our concern about bias in the data and the ethics of using modeling, and they commissioned a separate ethical analysis as part of their proposal. It's also just worth noting that we've invested in 2 evaluations, so a process evaluation and an impact evaluation. And all of these materials, the methodology paper, the ethical review, our response to the ethical analysis, and the evaluations, as they're completed, will be available on our website. So just walking through a little bit of the way we've been implementing predictive risk modeling in Allegheny.
The slide shows 14,121 referrals to child welfare. 53% were screened out, and 47% were screened in.
In a recent year, I think 2016, there were over 14,000 calls to the hotline, and we chose to investigate. We screened in about half of those, meaning unlike law enforcement who responds to every single case, every single call for service, we respond to about half. And the question for us was, can we use the administrative data to help workers make a better decision? Sometimes callers call and have a lot of information, and sometimes they call with very sparse information, and we thought administrative data could augment worker decision making.
An illustration shows a circle with segments arranged clockwise to represent data on child and family history. The segments are labeled housing and income support, child welfare, drug and alcohol, criminal justice, mental health, school, and family support.
As I already mentioned, we've had this rich history, historic information, historic data that workers could use, but they didn't use it in any systematic way.
The list includes 1. No standardized protocols for using data to make referral screening decisions. 2. No method for systematically weighting this information in an equitable manner across all referrals. 3. No understanding of what information is correlated or predicts future outcomes for children.
Nobody was sort of doing the math for them. I might have a shorthand of if I see any criminal justice system involvement, that's a concern for me, and I think we should investigate those cases, where somebody else could have a shorthand that domestic violence and drug and alcohol issues are really what concerns them because of their experience. And those are cases they think are really to be investigated. What predictive risk modeling can help us to do is reduce variation and kind of do that math that helps the workers actually understand the likelihood that that history results in an adverse outcome. So we set out to develop a score. We used 1 to 20 scale, and you could use 1 to 100, you could use 1 to 10, we used 1 to 20. So if you're looking at the ones on the score, on the scale, this is the lowest 5% of risk. If you're looking at the 20s, this is the highest 5% of risk. I'll come back to those 1s and 20s, so if you can try to keep them in your mind.
Examples of adverse outcomes include abuse, placement, and re-referral.
So the issue of what to predict is a really challenging one. In our case, we chose, at least in this first instance, to predict 2 things at the same time. So the likelihood of a re-referral given a screen out, and the likelihood of a home removal given screen in.
Researchers built a screening model based on data that was already collected and identified more than 100 factors that predict future referral or placement. The model was tested to see if it would improve the accuracy of screening decisions by scoring thousands of historical maltreatment calls, and then followed the children in subsequent referrals to see how the model was correct.
These are both outcomes that the child welfare system alone does not control. The community has to make that re-referral. They're calling the agency again, saying that they have a concern. In the case of a home removal, the court is involved, there's a judge, and so on. So just a little bit about the results of the modeling. Let's think about those ones, the lowest 5% of risk. 1 in 10 of those kids were re-referred to the agency within 2 years. So those risk score of a 1, the lowest 5%, 1 in 10 were referred back to the agency within 2 years. If we think about those 20s, the highest 5% of risk, 9 in 10, actually over 9 in 10, 94% of those kids were referred back to the agency within 2 years. So you can see there's great variation in risk between the kids in the lowest and the highest risk portfolio. Let's look at the out-of-home placement model. So the lowest 5% of risk, those ones, 1 in 100 of those kids had home removal within 2 years, where 1 in 2 of kids in the highest risk pool had a home removal within 2 years, right? And so, 1 in 2 is 1 in 2. That's a high likelihood of a very serious event like a home removal. But there's also that child, the other half, that wasn't removed, right? And one of the things that we're struggling to do, but we're committed to doing, is really understanding the protective factors and the resilience, and not just taking these modeling, the administrative data for what we have, and trying to understand why kids kind of buck the trend and are resilient in that way. So let me just tell you about the results, what our current practice look like. So thinking about those highest 5%. In current practice, before we implemented the model, we were screening out over a quarter of those. So 27% of those kids, those highest risk kids, we were not choosing to investigate.
Of these children, 1 in 3 are re-referred and placed within 2 years of the initial screened out call.
And think about the low end, nearly half, 48% of those kids, we were going out and investigating.
Of these children, only 1.4% are placed within 2 years.
And so I think what the child welfare director felt was that we could use these data to do something different at least to go check on those high-risk kids and make sure they're doing okay, do that investigation, and maybe look at those lower-risk kids and see if there really is a need to be investigating. So just a little bit about how the score fits into current practice. So a call comes into the hotline and the worker still needs to assess the allegations. They need to call collaterals. They look at historic data. They make an assessment of risk and safety at that point, and they enter that into our data systems. At that point, that information locks down, and they must look at the screening score. So the Allegheny Family Screening Tool presents a score, both a numeric and kind of banded score between low, moderate, and high.
An illustration of the Allegheny screening tool shows low risk as green at the bottom, moderate risk as yellow in the middle, and high risk as orange at the top.
And so they have that information. So now they have the likelihood of an adverse event within 2 years, so sort of long arc risk, plus their assessment of the current allegation. And they use those two pieces to make a decision about whether to screen the case in or to screen it out. It's important to note that that information, the score, doesn't go any further than the call screening unit. It is not passed on to the investigator. It's not passed on to the family services worker. It stays with the screening unit because we worry that if that score travels with people, that they will just assume that they're of high risk. They'll go looking for things that their investigation wouldn't have naturally found. We want them to do their investigation work the way we've trained them to do. We just want to make sure we're investigating the right cases. So we're really excited to see how this is going. We've been implementing since August 1st, the evaluation results aren't due in for a couple more months. I think the workforce is adapting to the change in their business process, having to look at the score. One thing they do tell us about it is that it causes them to kind of slow down their thinking. If they have an allegation that is in their minds fairly less serious, and then they see a high score on the screening tool, they think, let me think through this through again, let me conference this differently with my supervisor. One other thing to just note is that you sort of never get the stuff perfect from the beginning. You could plan forever and always be nervous about rolling out something new and big like this, but at some point you have to roll out. So we have made changes to the system, including a pretty big change in November of this year. And I think the lesson there is that you don't have perfect foresight on how these systems actually work in the real world, and have to have flexibility both to implement, to make that decision to go forward, and then to change it if you need to do that. So as soon as those results are available, we'll be sharing them with the field. And so for more information, you can access the Allegheny Analytics website.
You can visit the website at www.alleghenycountyanalytics.us. That's www.alleghenycountyanalytics.us. The website includes analyzed data in reports and interactive visualizations and open data. You may also contact Erin at erin.dalton@alleghenycounty.us.
Thanks again for inviting us here to participate, and just really appreciate the opportunity. Thanks.
Panel discussion, Opportunities for Data-Driven Practice, moderated by Melissa Correa, Data Lead at the Capacity Building Center for States.
Erin, thank you so much for providing all the interesting information about what you're doing with integrated data in Allegheny County. I always love to hear about what you're working on. And I think it's important also that we have a number of different perspectives when we have conversations about how we're using data in child welfare. So we have a number of other panelists that have joined us, and they do represent different perspectives from the field. And I'd like you all to start with just introducing yourselves, maybe your name and your role at your agency. Sure. Starting here with you.
So I'm Melody Vielbig. I work with the Department of Family Services in Fairfax County, Virginia, and I'm a foster care and adoption supervisor.
Thank you.
I am Nahawa Tangula. I am a management analyst at the Children, Youth, and Families Division at Fairfax County's Department of Family Services.
Hi, I'm Aaron Ford. I am a young adult consultant with the Capacity Building Center for States.
Hi, I'm Erin Dalton. I'm with Allegheny County's Department of Human Services, and there I run analytics.
And hi, I'm Sandy Slappy. I'm the Quality Assurance Manager for Child Welfare Services in Fairfax County's Department of Family Services.
Thank you. So I'm excited. We have quality assurance managers, we have data people, we've got a youth consultant, a foster care manager, and Erin, of course, analytics wizard. So thank you all for coming. I mean, I really appreciate the time, taking the time out of your busy days and out of your day-to-day routines to be here with us. We heard great information about how integrated data can really help child welfare systems, really help with assessment and decision making. And I have a number of different topics that I'd like to bring up and just hear from your perspective, any reactions that you had to some of the things that Erin brought up, or to some of these other discussion points. So in just thinking about how does having access to high quality data impact decision making in your agency or in the work that you do, how are data connected to service delivery or to outcomes? So this could be, for example, what kinds of reports do you provide to frontline staff, or what have you found that's useful in really implementing practice changes that are tied to data that you have? Want to take a stab at that?
Nahawa.
As a management analyst, one of my primary responsibilities is developing quantitative reports for frontline staff, supervisors, and other stakeholders. So requests for reports usually vary, but the content is mostly focused on client demographics, case characteristics, program caseloads, and performance measures. So on a weekly basis, I am asked to submit information on the number of calls to the hotline, validated reports, the types of referral responses that we have, family assessments versus investigation types of cases, and caseload per staff. Monthly reports, for those, supervisors really want to delve down and get a sense of how their individual units and their programs are progressing with regard to meeting those targets for certain compliance measures, like the number of clients that were visited for CPS ongoing and prevention support programs versus those that were not visited. And also at CYF, at the end of the fiscal year, we prepare results-based accountability reports. For each program, there are about 3 to 5 outcomes. And for each outcome area, we measure how much work is done. So the scope of work, for instance, for CPS, we'll take a look at the number of referrals received, how well we did the work. So those timeliness measures and who was impacted by it. We take a look at referral recidivism, and also for other programs, we take a look at the number of children that stayed safely in their homes versus those that went into foster care. So usually those are the types of information that staff members want, and helps them in determining how we're performing and how to make changes moving forward to maybe include some outcomes that we were not looking at prior, before, and add them moving forward.
Wow, it sounds like you're really busy.
Yeah, we are.
Melody.
Always.
And thank goodness for her. She's collecting data for supervisors like myself who, stay in the weeds a lot with workers and with families, and it's when we get this monthly data or this weekly data that we kind of pull up and get a more balcony view of what's happening with our families, where the kids are coming from in foster care, the different regions, because we're regionalized in our county, so where are we seeing more of the removals? How old are these kids? How do we know what kind of issues the families are coming in with, so that we can seek out services if we don't have the services, that we design services that best meet the needs, that we're developing skills in our workers so that they have the skills to address, the difference between when I started in '95 and we were dealing with, crack cocaine, and now that we're dealing with opioid addiction. These are very different clientele populations, and we need different strengths, we need different awareness. And the kids that we're working with are much, much more traumatized because we're bringing in only the kids that we cannot find any other way, and we really need to understand these families. And it's data that helps us do that. So.
That's great. You know, I've heard that from a number of different agencies that with an increased focus on prevention and in-home services, that the families coming into or children coming into foster care have higher needs, have different needs.
Yes.
And I do think that a lot of our data can be tapped to really help us understand the changing service delivery needs of our agencies. So it's not enough to understand what it looked like 5 years ago. Right, but to continue to look at that information over time to see what's changing.
Sandy.
To that end, what Nahawa and Melody have both been speaking to, you asked at first about the effect or the impact of having data on decision making. You know, to some degree, without it, we know how we make decisions. We make them based on stories. We make them based on who's got the loudest voice. We make them based on the worst case scenario that's at the top of everybody's mind, even though it's not the most prevalent circumstance. So the data helps us make sure that we're making decisions based on our reality. You talked about substance abuse. We recently had a manager who wanted to implement a new strategy, a new intervention to work with our parents who are struggling with substance abuse. We went to get the data to look at the prevalence of substance abuse among our clients and realized it wasn't good quality data. We had some reporting going on, but Nahawa and the other analysts were looking at it. We can't rely on it. So we'll do a special data collection, and then we'll look at how do we improve our ongoing data collection so we can truly know the scope of this problem, and then go after funding, go after partnerships to help us implement a strategy to help with that. Because we know it will ultimately help, for example, with permanency. Melody said we've been able, through data, to track, I think we had 800 and some children in foster care at our high rate in the late 90s. We're down to about 260 kids in care at any given time now. I don't have an evaluation that can directly tie our prevention efforts to that, but I can tell you there's been very targeted efforts to bring that down. We feel that they're having some incredible results. We're measuring how well we're keeping kids out of foster care with our in-home services. So it all makes a difference, and we need the data to help us tell the true story.
I love that. I say that all the time. I think it's in my LinkedIn profile that I call myself a data storyteller.
Yes.
I think it's so important that we tell our story not just to those who are writing policy or perhaps to the press, to the community, to our clients themselves, and to our own staff, right? Because I think the other challenge we have is the data comes in and it doesn't go out, right? So caseworkers don't get a lot of information all the time. So it's exciting to hear that you all are doing such great work. Another question though that comes to mind is what are the challenges here with doing this work? And is there any point where we've really gone too far with data collection? Is there, what kinds of concerns do we have about the way that our agents at Child Welfare is focusing on the use of data?
Erin.
I'll start. I don't know about all of you guys, but our child welfare case management system has over 1,000 tables, and we're not using most of that data, returning it back to the field. We take that whole data system and create a flat file that we use to analyze and understand that data better. So I think there is a whole lot of data that is going into these systems without a lot of return to the workforce, and I hope next generation systems we take into account what data we really need in order to protect kids.
Thanks.
Melody.
And I think we have older data systems that are very difficult to retrieve. So for instance, if we in foster care receive a case of say a child that's been removed from a family, it's going to take us sometimes days to do all the searches to see how many contacts this family has had within this community of services that we work with, not just community services board or public health, but even our own system, like to know how many times CPS has actually been out involved with this family. It takes too much time to do that, whereas if we had that information walking out the door when we're meeting with this family, we would know so much more, and then it would be a better starting point for the conversations with these families.
Yeah. I think it's so important that the data, that when we are able to provide data back to the field, that they understand what to do with it, right? And that they know, oh, okay, I have this information about the family. I can apply this to my decision making or to my case planning.
Sandy.
And the time it takes to clean the data, you talked about, when you have problems with data entry, you talked about challenges with data. That's a big one. Data can be entered in error or not in a timely way, and reports are produced, but they're not complete. So our analyst time in cleaning the data to produce reliable reports is a big problem. The antiquated data systems that we can't get reports back out of. So in Fairfax, we've created some local databases, duplicate data entry. Think about the staff time for this, but we've done that so we can have data to analyze, so we can have reports that tell us something about who we're serving and the services we're providing. But we need to get away from that. We need to have the single state data system who can give us the reports in real time to help us manage our workload. And we're working towards that. I know the state is working towards that, and with the new CCWIS and the requirements for that.
Lots of opportunities. Erin, is there anything from your perspective that that you think would really be beneficial for us to talk about related to the use of data in making child welfare case planning decisions?
Aaron.
I think data is extremely important. Outside of just ensuring that we always evaluate each case like individually, like don't allow data to inform all decisions, because there is, you might have quantitative data, but the qualitative data is also extremely important when making a decision for a family. But I think even at a macro level of, looking at how we use data in systems, like using like the systems perspective, it might make it a lot easier for us to understand the pathology of the individual or the families, and understand that's when we talk about data sharing, why it's really important, because you can see all the various systems that family or individual is interacting with, and then you can make a better informed decision to impact them on a micro level about what interventions and strategies using evidence-based practices might be most beneficial to them.
Yeah, absolutely. And I think that's a nice segue, actually, to talking a little bit about data sharing and data sharing partnerships. A lot of what we're talking about is really data sharing partnerships are required to really have the kind of information that we want to have in order to inform our systems and to inform our individual case level decisions. So in thinking about that, though, I wonder how does that work? Where do you start with developing a partnership to share data? What are the lessons learned if you've done some of that, or what are the challenges and barriers to getting there? I'm looking over here at this side. I see some heads
Sandy.
nodding. But
Well, I'm thinking of Allegheny. Fairfax County, Virginia is embarking on, we're calling it the 5-year roadmap to integrate the data systems across our human service agencies. So our family services, our health department, our community services board, which is our mental health, substance abuse, intellectual disability, those. It's an enormous effort. We got a demonstration from Allegheny and a number of other jurisdictions that have done that. But as I said, it's a 5-year roadmap. Because between the state systems and the local systems and the confidentiality issues and the data system issues themselves, it's enormously challenging. But when you were giving your presentation, Erin, we were hearing some of the benefits, and that's why we're doing it. So clients can give their information one time. I think, Erin, you were referencing this. And with that information, we can determine eligibility for multiple programs across multiple agencies with one gathering of information. How wonderful is that? We can verify. If there's an address and something's not turning up, you can double check. It can help us reach our clients more effectively.
Yeah.
So that's something that we're really working towards. It's a long road.
Melody.
Because currently we're doing it in the person way. We invite those people to meetings where they bring their data with them and we talk about it at a meeting. But there's not, to be able to find the right person with the right data at a time when you need to make major decisions with families. To wait for a meeting sometimes is really detrimental to moving families through. And especially in foster care, when we have a 12-month time frame in which to move these kids towards permanency, this is really an area where we know we can do better to influence the other factors that you're talking about, how we interact with these families, the kinds of services that we offer, the kinds of ways that we help them make sense of the system.
yeah, so you need good relationships to establish data partnerships, right? Data sharing
Absolutely.
partnerships. But also, I think having and sharing data can also build that collaborative process. So when the Child Welfare Agency is willing to be transparent and to share information, it really does, I think, and from my perspective, help to facilitate that collaborative spirit. This idea that we're in it together. No one agency has the solution to the challenges that families face.
And I think what Erin was saying about the shared ownership of the families and the clients, that they belong to us as a community, to a whole, versus the turf building and the expertise that we build, versus saying this is our community's child, this is our community's family, and we're all in this together, and we all have resources and expertise and deficits that we need each other for.
Nahawa.
And I think another thing is when you have partnerships like that, it increases the technological capacity of all the partners involved, because Right now, different agencies are collecting data in a different way. When you pull all your resources together and you're able to report on certain variables and be able to really demonstrate that the work that you're doing has an impact. You're making a difference in the community. For those agencies that don't right now have the technological capacity, pulling their resources together, I think that definitely will help them, like motivate them to continue partnerships or sort out partnerships, because at the end of the day, it helps your programs as a whole. It helps your agency to be more viable, you know.
Erin.
Yeah, there are a lot of examples around the country beyond Allegheny County, and Allegheny County is just one model. So I, of course, like the government model where the data stays within the government because it's easier to use it in action that way. But in many places around the country, universities play this role. So they're the ones who gather the data and help to provide the kind of cross-system analysis. There are nonprofit data centers who also do the same thing in various agencies. One of the practical things I like to talk about, is that around the country, I think a lot of people are trying to share data amongst agencies that are actually controlled by the same umbrella. So I like to say that you shouldn't sign MOUs if you're going to sign both sides, right? So, what is the necessity of? So, the agencies or government is sort of at one entity, and then there's administrative management bureaus set up. So, the Department of Human Services in Allegheny County isn't really a thing. There's really only the county. And so there's no reason to sign a data sharing agreement with the health department or the jail, or certainly within our own agency between child welfare and mental health or drug and alcohol. It doesn't mean you don't need relationships and protocols to share that data, but so much time, years can go by trying to craft an MOU that isn't even necessary to craft in the first place. And so that's just one of the things that in our experience people are really running up against, spending a whole lot of time trying to create legal agreements where legal agreements may not be necessary.
What about some of the ethical concerns? What are some concerns that families might have or youth may have about all of this information being so easily accessible?
Aaron.
I think that one concern could possibly be the lifetime of that data, like how long that might follow you, because there are people who may have just like after you turn 18, certain files are sealed. It should probably be the same thing with data, just to ensure that if somebody does want to change or move on with their life, that information isn't following them. Even though I do think that there should be some form of like tracking so we can really understand outcomes, because a lot of this stuff is just figurative and what we think is are happening to youth 10, 15 years down the line. So but I think that might be a concern in how we ensure that the privacy of the youth and families are being protected. Also, it would also, I think, who can actually access the data to ensure that, say one of those youth wants to apply for a job in that same county or state that they work for, that people can't just go and look up what services they've accessed or utilize and understand. All right, this is their they've had X amount of involvements with the criminal justice system. Those type of things. It's just making sure that we have like an ethical standard that just ensures privacy.
Melody.
But I think on the flip side of that, what's interesting is I think that for families, they think that we share data anyway. I mean, I think because self-sufficiency and foster care and all these programs are under the same umbrella, that we would be doing this anyway. And how frustrating for them to have given self-sufficiency a copy of their birth certificate or a copy of their social security card, and then we come back and say, can we have it? And they're like, we already gave it to you. And you're thinking, no, you gave it to them and we don't talk. Not really. That it's one less step for the family. So there's that balance between ease of access, but also making sure that they know where that information goes so that they do feel like their privacy is respected. And it's used for what it was meant to be used for. Yeah.
Sandy.
I think that privacy is such an important issue. In child welfare and other services, we really want to respect. Families don't necessarily want everybody they're involved with to know that they have a case with Child Protective Services and with our agency. So schools and other folks, if there's a need to know and if they are okay with that and we ask them, that's fine. But I think that's probably a big concern as well. is making sure that we don't share their involvement with us unless there's really a reason to.
Right.
Erin.
One of the interesting things that, at least in Allegheny, that our algorithms do, the predictive analytics that I talked about, is take care, well, at least in part, take care of the issue you were talking about in terms of the length that data can follow you, because we know that time is so important. So if it's been 3 years since the last Child Protective Services call, that's much less meaningful than if it's been in the last 30 days. And so where kind of files live forever, and they can, you can have access to them, these modeling can help to create meaningful information, so that so that if it's been a long time since there had been a particular event, that's sort of used to help understand the case better.
Those are all really good points. Thank you. So I want to talk, you mentioned predictive analytics. It's almost as if you knew what my next question was going to be.
It's predictive.
Yes. Some agencies gather data, right, from a variety of sources and conduct this research that Erin was describing to help identify flags or predictors of some future outcome, maybe re-entry or re-referral. And I think there are a lot of other examples of that, so I just wondered if there are other examples that you've heard of how agencies are using that kind of data to predict maybe some different kinds of outcomes, or any future work in this area. I know some work that I am aware of in Rhode Island is related to not predicting some of the common things that we hear about are child fatalities or severe maltreatment or even repeat maltreatment. But I've also heard about predictive models that will help us to identify those children or youth who may stay in care a very long time. And then the question, though, for me, and why I'm so excited to have a more practice perspective here with us is how do you deliver those data to the field in a way that helps them? Do they understand what to do with it, right? If they get this data, do they know? Is there some different practice they should be doing? Is there some different service they should be delivering?
Melody.
So I don't know.
I think about the fact when we talk about youth who age out of foster care, and we're working with them now, and we see these statistics about what happens to them as they leave, and it changes how we offer training, how we shift the kinds of homes we want them to be involved with, how we look at connections so differently now. Now in the state of Virginia, we're able to, at 18, if this youth wants to go live it with their birth parent, but stay and work with foster care, we can do that.
Yeah.
Go back home, work through that, but you still get the support. Why? Because we've learned that this is where kids go. They go back home. And so that tells us that our work needs to be not in stopping them from joining families, but working with them as they make those decisions and still being there and sort of launching them from that place. So I think that's part of how it shifts our practice.
Yeah.
That we accept that's the reality, we work with that, and we keep going.
Great, thank you.
Sandy.
In Fairfax, we haven't done any predictive analytics yet. We've been talking about it. We're very interested in it. As you mentioned earlier, our analysts like Nahawa are already very, very busy. I wish we had more analysts and we could do more and start to venture into that. One of the areas that I believe would be most interesting for us would be what predicts those who will stay in care and age out and not exit to permanency. While we've been doing a fantastic job with keeping children safely out of foster care with families, those that come into care, our permanency rate isn't nearly where we want it to be. So if we had a better understanding about who is not leaving care to a permanent family, and then to your question, what do we do with that? So we're already implementing a lot of different strategies we have over the past 10 years or so to try to support our permanency efforts. Permanency roundtables, better family finding and engagement efforts. We've done more supportive foster families and reflections, trauma-based training for foster families because we know that relationship is so crucially important. So that's the excellent question. What else would we do? Would we target our interventions differently to certain children if we knew they were more at risk of staying in care? That would be the question before us to embark on that.
Erin.
Right. One sort of flipped example that we did in Allegheny was looking at school outcomes for kids across the human services system. And one of the things that we found that you could actually modify, was the high likelihood that kids who aren't doing well in school, chronically absent, GPA below 2.5, that they had a lot of school moves. And so to think about what our responsibility as the human services system is in that outcome, so we thought we could do something about school moves associated with child welfare placements, and we set out to do that, and really did see a reduction in school moves associated with child welfare. We can't reduce all moves that kids move for other reasons, but we did set out to sort of impact that one piece of a broader puzzle.
I love that. That's a great example.
Yeah.
Thanks. So one last question for all of you, and that's what is exciting for you? What's upcoming? What are some maybe a new initiative, something new that you're doing in your work? What are you excited about for the coming years?
Sandy.
I'll start. I think one of the big things we're doing in our agency that's very exciting, it's called Data Fellows. It's an initiative where staff across our department, not necessarily analyst staff, everyday staff from child welfare and our benefits division and our child care across the agency are coming together. It's pretty intensive. It's 3 days a month for 10 months. And they're learning how to understand data, how to read it, how to use it, how to ask questions from it, how to clean it, how to analyze and present it and tell stories with it. It's an incredibly intense and sometimes frustrating all day with data. They're getting so much out of it, and the idea being that this is going to help them do their work better, whether they're a frontline worker or a supervisor. And already they're coming back with stories. I know there's a person in Melody's unit who's in our Data Fellows program, and he works with families at the court, children that have been petitioned, where parents petitioned to be relieved of custody. And he was collecting some data on who these kids and families were, and this Data Fellows program has got him thinking differently. One of you were talking earlier about, do we sometimes collect the wrong data or too much data? And he started to look at it and say, well, this stuff was created years ago. I'm not sure I need all of these things, but you know what I'm always wondering about? I want to collect these different elements. And this is what I would do with that. And he's a line worker. So we're very excited about the Data Fellows program, and we hope that's going to start helping people across our agency better understand and use data to tell stories.
Yay!
That's
Very
exciting.
exciting.
I know.
I love Data Fellows programs.
Yeah,
They come by many names.
Erin.
Yeah, we've had a similar program in Allegheny for a couple of years, and in addition to everything that you just mentioned, workers are the ones who actually, when they realize that something is wrong or that could be done better, they're the ones who actually make the change. So I can say all day long that I think this would maybe work better, you could try something like that. Until they realize that congregate care or something, for example, is not best for kids on their own, based on their own inquiry, it really doesn't change in their minds. I'll just say one thing that we're excited about in Allegheny is doing more client engagement work. So I think another reason that clients feel okay with the very open way that Allegheny shares data is because we give it back to them first and foremost. And we're creating a whole new set of technologies that will better engage clients and communities in our planning efforts and in our work, including kind of rate your provider tool, integrated with getting your data back, finding services, making a complaint or asking a question of the department, and a number of other kind of engagement strategies that I hope bring clients and communities more into our work.
That's great. So real quick to wrap it up, any other exciting, that's exciting for you, Erin?
So right now I'm actually working with Montgomery County, Maryland, to establish a youth housing survey. They currently don't have one. So just around data, understanding the importance of having information and actually an actual count on how many youth are actually experiencing homelessness in the county, so that whatever intervention and prevention strategy you actually implement, that you have some way to actually evaluate if they're successful at all. And understanding that not having anything on the onset is like, you're basically losing money because you really don't know how much you're spending or what you actually need to spend.
Great. Nahawa?
As an analyst, I am always excited about data quality. I guess just keep on doing my work with staff to identify data issues, collaborate with them in rectifying those issues to ensure that the information we collect is accurate and complete, and we can produce reports that inform stakeholders at all levels and help them to make strategic decisions. So Yeah,
I'm going to add to that real quickly. The work that Naha was doing with infographics to present data in a way that folks who don't normally like to look at data are attracted and to it and see it and understand it. You've been doing,
Melody.
Absolutely. And I think I'm excited that we are working hard on including more youth voice in our policy and data-driven practices. So we are looking at both kids that are in care as well as alumni to help us shape what kind of questions we ask as we're looking forward to making some changes and helping kids age out and be successful.
Melissa.
And what I've been hearing from this entire conversation and what I'm most excited about is breaking down these artificial barriers between data people and program people. I hear a lot of great stuff from all of you. So thank you again very much for sharing this information with us.
Thank you for having us.